Hi farmer friends, I'm here today with my good friend and president of the Victorian Pharmacy Guild, Anthony Tassone. Anthony and I have quite the history together. We went through university and spent a lot of time together, probably doing things that weren't necessarily pharmacy related, but it got us to this point anyway. Anthony, I thought I would bring in a little bit of a reflection so that everyone could actually see some evidence that we did graduate pharmacy.
We got through it.
We did at some point. So you can see we look quite young and innocent.
Who is that guy on the right? What happened to him?
What do you think you were thinking the next 20 or 25 years we're going to hold when we were just graduating from our pharmacy degree?
In all honesty, when we're going through university, it was all about, are you doing hospital or are you doing retail? Hospital, retail, right? Yeah. It was binary. And I hate hearing the word retail pharmacy. Community pharmacy is what we're all about. But the last 20 years has been extraordinary, particularly the last 2 years, really. So couldn't have imagined when we graduated from Monash University in Parkville back in the early 2000s that we'd be in a position giving vaccinations, being at the forefront of primary care, keeping our doors open through a global pandemic, really pushing the boundaries of our scope of practice and really increasing the trust that the public has in our profession and in community pharmacy. Bright-eyed and naive at the time with all sorts of dreams, but I'm really proud and excited of what our profession has been able to achieve and really impressed with what Pasquale's been able to achieve in his business with Beeswax in providing bookkeeping and support services for pharmacies and to help you all get to do what you do best in looking after your patients and delivering healthcare.
Yeah, mate, it's awesome. I go to the family side of things as well. I think 2 kids, heart attack, all that stuff that was laid out before us, and to figure we've gotten to this point where probably for me, I'm probably enjoying my work the most I've ever enjoyed it, and talking to pharmacists and actually being on the ground helping them with real, I guess, support. That's made a massive difference for me over the last, 6 or 7 years since Beeswax has been going, so it's awesome. Mate, I thought we would have this, as my kids watch a lot of YouTube videos, I thought this is what they call a collab in the biz. So I thought it would be good to get the benefit of your insight, give the guys that subscribe to the Beehive a little bit of my insight as well, just with our standard numbers and things that we generally go through. But what do you think are the highlights of the last 12 months, given that we've just finished the financial year? What do you think has really been the highlights that you've seen?
So from community pharmacy's perspective, across the country, resilience and turning up and being there for our patients. And we've been there for our patients, right? It's in our DNA. There was never going to be any doubt, but the ability to be super subs off the bench in the COVID vaccination rollout and come in late in the game and have such an impact. So we've had 8 million doses of the COVID vaccine delivered.
When did it actually start? When did we do our first vaccine?
It would have been around late June, early July last year in Queensland, where there was about 50 odd pharmacies in regional Queensland in late June. That's when it started, and it really didn't ramp up across the country till late September when Moderna became available. And that all seems like a distant memory, giving out first doses of Moderna, but here we are now giving 4th doses of the COVID vaccine. So there's been that. There's been the Concessional Rapids, the Concessional Rats program from late January that will be concluding on the 31st of July. And I'll say to your viewers, it's finishing on the 31st of July.
Yeah, lock it in. Yeah.
Okay, it's not going to be extended. We have tried our very best for it to be further extended. It's not. So please make sure that those eligible patients who haven't got their full quota of concessional rats yet, get them before the end of July, because the window's closing. And that has been an extraordinary program for community pharmacy. There's probably been, last estimates, around $800 million of revenue that has come to pharmacy by the end of this program estimate. And to put that in context, that's more than 3 years worth of community pharmacy programs in the CPA, in the community pharmacy agreement. You take 3 years of those programs of dose administration aids, med checks and all that, and that's what we've had with the concessional rapids program over the last 6 months.
How awesome was it that we rolled it out so quickly?
Yeah.
Like, that was the amazing thing to me. It was just like, right, we're doing this, get it done.
Yeah,
and we
so
stepped up.
I tried to take a couple of weeks off, Christmas and New Year, and I think I got 2 days off. I had a phone call from our national president, Trent Toomey, who had been speaking with then Prime Minister Scott Morrison around a concessional rapids program, and basically the directive was we need to stand up a software recording platform and a program to deliver concessional rapids, and we had 2 to 3 weeks to do it, and we did it.
Amazing.
And not to do too much of a sell job around guild membership, I can tell you if it wasn't for guild or guild membership, this would not have happened.
Yeah.
This would not have happened. GuildLink were fantastic in standing up the program really quickly. Advocacy around getting increased remuneration for booster doses, which we got just before Christmas of $26. That was important. And we've got unfinished business there to do with first dose of COVID vaccines. The free flu vaccine programs that have been in all states, not ACT or Northern Territory, not the territories, but every state has had a free flu vaccine program this year. First time that that's happened, and that's been really significant as well. And we'll keep on pushing for next year to have a better nationally coordinated program. So there's been some really important highlights, but the most important thing is not just the Guild advocating for community pharmacy and our members to get better outcomes for patients. The extraordinary work has been the pharmacies themselves, and the staff turning up and being there for their patients and being so critical to helping keeping people safe. So thank you, awesome stuff.
Yeah. So I guess that leads on to the next thing that I wanted to chat about. So staff. How are you seeing? I know what I'm seeing with my clients, and the fact that we've just started a job listings page on the Beeswax homepage. So if guys are keen to have a look at the job listings we've got on there, we do offer it as a free service for our clients. So that can help get the word out about staffing. But how are you seeing pharmacies cope with the staff shortages that are probably unprecedented since you and I even started?
Yeah, it is. It's tough. It's national.
Yeah.
It's pharmacists and pharmacy assistants. And it's a complex problem without a simple solution. So pharmacists have returned to the skilled migration list last year, but there takes time for skilled migrants to come to Australia, get visas approved or go through that process. So the Guild is doing plenty of work to build up awareness for our members of if you want to sponsor an overseas skilled migrant being a pharmacist, what the process will be. So stay tuned on that, as well as education programs for new entrants into Australia about the PBS and around the Australian healthcare system. So we're dedicating time to that. It's economy-wide workforce. Yeah. So no matter which industry or profession you speak with, there's issues. So it is really tough. And what I would say to any pharmacy or pharmacist colleague is you're not alone there. And I know that's not much comfort, but also don't overlook the importance of retaining your staff now. And whatnot. So that's just as important. Looking after the staff you have now, keeping the morale of your team as much as possible. That's really important to keep your team together. Because if pharmacies actually can keep their team together, actually have enough workforce to deliver some services, they're actually doing quite well, broadly speaking, business-wise. Yeah. And that might mean to keep your head above water, and it's hard as a pharmacist and a pharmacy owner, saying the word no. It's really hard because we're always yes, I can do that home delivery on my way home. Yes, we'll stay open. Yes, we'll open on that public holiday. Yes. No can be as easy as yes to say with enough practice. And what I'm seeing in pharmacy at the moment is a reduction in trading hours, concentrating on core services and really, really honing in on what is essential for us to deliver for our patients. It's most important because you can't do everything. You've only got 100% to give. And focusing on that is really important to keep your own sanity, but to also make sure you don't overlook those core services every day. Yeah. And one thing I think that I've seen some success with our clients has been, rather than offering, there's been a little bit of consternation out there where pharmacists are saying they can't get staff, but if you look at the shifts they're actually offering, they're actually the piddly little shifts on a Wednesday night from 5 till 10 that nobody wants to do.
you actually need to probably open up to offering some more of the, I guess, the ideal shifts, you know, a 10 till 3 or a 9 till 5 shift, to actually attract the staff to want to come and work. Because let's face it, with the longer trading hours that pharmacy has sort of become known for over the last 20 years, to find pharmacists to fill those little niche gaps just to plug holes, that's going to be the really difficult bit.
I don't know about your viewers, but in my 16 years of ownership, I cannot ever remember a time where I've hired someone, got them in, and there wasn't more shifts available.
Yeah.
All right? So even if someone doesn't have everything they want on day one, it's got to be sufficiently attractive enough for them to want to join, because there's more jobs than people at the moment, right? So people have choice. It's a real buyer's market in the employment market. So do whatever you can to be able to attract that talent, because there will be possibilities once they get their foot in the door.
For sure. Yeah, absolutely. And look, I guess the last thing that I wanted to ask you about, so probably crystal balling it a little bit. So if we could fast forward through the end of this financial year, and if we catch up again in 12 months' time, what would you like to look back on and say, that's awesome, pharmacy achieved this, this and this. That was really what we wanted to, as a guild, wanted to get pharmacists to start doing. And I guess for me, it's I'd like them to be able to take their foot off the pedal a little bit, so just to catch their breath. But what are you guys seeing from the guild that you'd like to happen?
Yeah, it's a challenge, because it's hard to look 2 weeks in advance, let alone months and whatnot. But look, if we did another collab in about 12 months' time, it would be good to look back and see things become business as usual. Things like the really great results out of Queensland for the UTI prescribing pilot for antibiotics for UTI. So that's now been made permanent in Queensland. Let's see it in other states.
Yeah.
What we're seeing is with the COVID vaccination, that there's authorisations for younger and younger patients to be able to be vaccinated by their pharmacists. And it's not for everyone, I get that, but it will become business as usual that pharmacists will be giving vaccines to children. It could be as young as 6 months old with Moderna. That just becomes part of what we do. Being able to do more vaccines, potentially travel vaccines and other things. So things that we have been advocating for so long, and like trying to push that rock down the hill, like pushing and feel like you're not getting anywhere, and then that nudge just lets it tumble down, and we'll look back and go, how come we weren't always able to do this? It just becomes so natural. So the momentum's building, and I think what's really important for business owners is not only to keep your team together and retain a sufficient workforce, but there is higher wage expenses that are coming through because you're having to retain and attract that workforce. And that's a good thing that pharmacists are getting well remunerated, but that bakes in higher operational costs, and it's just got to be sustainable on your business planning, because Concessional Rapids, that's ending 31st of July. So there's certain programs that the free flu vaccine program has already ended in most states. So these sorts of things have been great, but you've just got to manage your expenses based on what your business planning is at the time.
Yeah, awesome. Anthony, thank you.
No worries.
I appreciate it. I'm going to just let the guys know just our standard pharmacy data wrap. But mate, I look forward to doing another collab soon.
No, thank you. And it's great to be doing it in my office where some of the magic happens. This is one of the better things I've been able to do in my office. I've had some pretty interesting conversations with government ministers and their advisors and media in this room. But over to you, Swales. Good work.
Mate. Thanks. Okay, guys, so let me duck down so I'm in shot. So just with the pharmacy data app, so I've made some notes here. So medical centre pharmacies comparing May to June, they're up 3% this month, but comparing June 21 to June just gone, they're up 5%. So that's a really good growth that they've had there. Rural pharmacies May to June were down 2%, but they're actually up 6% comparing June 21 to June 22. So I think that's got to do with a lot of the travel that happened through the school holidays, comparing it to probably not much travel happening last year as well. Shopping strips, May to June, they're up 3%, but June 21 to June this year, up 4%. I think a lot of that is concessional rapids, and same with shopping centres. So May to June, up 5%. All right, again, school holidays, probably a lot more trade going through those shopping centres. And June 21 to 22, up a massive 7%. So again, on the back of some really good operators pushing the concessional rapids. So that's all for this month. All right, we'll get back to normal operation next month, but take care, sign up to the Beehive, and I'll catch you then.